My name is Sheela Roth. I am thrilled to have you with us today. I am the clinical director at Pearl, head of education. We'll be starting in just a moment, but I wanted you to think about a couple things just while you're getting settled in here. Um, if you work in pediatrics, what is the one thing you wish you could, just wave a magic wand and change? We'd love to have you put that in the chat. We're going to solve your problems today. No, I'm just kidding. But it is interesting to hear, some doctors talk about, oh, it's the flow, or oh, it's the case presentation, or oh, it's the parents. And we just love to hear from you. Um, Before we begin, we're also going to welcome Taylor DaChico, the Chief Commercial Officer at Oryx. Super excited to have you here. I'm going to turn it over to you, Taylor. We're super excited about our partnership with Pearl and Oryx. Love to have you welcome us, and then I'll introduce Dr. Milka.
Sure. Thank you so much. And thank you so much for everyone that is here today. We're very excited to welcome Dr. Milka and her topics. She is an incredible shared customer of both Oryx and Pearl. For those who are unfamiliar with Oryx, we are an all-in-one cloud-based dental practice management platform. Championing, oh my goodness, I'm sorry, it's Friday. Comprehensive clinical dentistry, but Oryx has everything you need to power your patient experience, offer clinical excellence to your teams, and power your practice management. So again, we're very excited to have Dr. Milka here and are equally excited about our partnership with the incredible team at Pearl.
Thank you so much, Taylor. Today's course focuses on how pediatric practices can create more predictable, efficient, and really parent-friendly visits as well. We're always focusing on the children, of course. I'm super thrilled to have, specialists doing that. We're going to talk a little bit about business processing, imaging workflows, and just clinical systems to create just a basic cohesive model, an hour by hour survival guide, right? We're going to look into how consistent intake is helping imaging sequences, exam flow, and really kind of dive into at that pivotal moment, how do we explain your child has a cavity, right? And what are some visual aids we can do to ensure they understand that? I know when I was a hygienist and I would always hear patients say, oh, well, they're going to fall out anyway, so we don't have to put a filling in there, right? And I thought, no, look at all these teeth underneath. So this is going to be an exciting webinar. I'm honored to introduce today's speaker. She goes by Dr. Milka. She is a board certified pediatric dentist and the founder of Pawsitive Pediatric Dentistry, which is so adorable. You can see this little dog. I'm sure you're going to share with us, but I don't know if you have dogs in there. I'm sure you do, and I think that's incredible. So can't wait to hear about that. Um, she's also working with Little Smiles Collaborative in Pennsylvania. Extensive experience also in infant oral health, preventative and restorative pediatric dentistry, and functional evaluations. We love that her approach focuses really on clear communication, which is what we all need as parents, strong systems to evaluate and make sure that we're giving the best care at all times, and creating supportive environments for both teams and families. Dr. Milka, we are so grateful to have you today to share real-world strategies and case examples. And again, love our partnership with Oryx. At the end, we'll do some housekeeping with some fun CE course, little codes you get to scan and some great calls to action if your team is ready to learn more about Pearl and Oryx. We'll talk to you at the end. So thanks to all of you for being here. Dr. Milka, we'll turn it over to you.
Perfect. Well, hi everyone. Thank you for being here. I'm very honored that you're here, and I hope that I know our time is very precious as dentists, as pediatric dentists. If there's a team member here representing your office, I know your time is precious too. You're probably having to put calls on pause or something's going on. So, my goal is that hopefully today, by sharing a little bit of our workflow at Pawsitive, that you're able to just take even just one nugget that you can put into practice on Monday morning. I love learning and I'm notorious for just collecting information. But if we don't really put anything into practice, like what's it worth? Was the time well invested or not? So before I kind of dive in here, just some housekeeping. I don't work for Oryx or Pearl, despite loving them so much. And we're going to go through a case study to kind of represent different aspects of the workflow that I typically have in my office and with my team. It's not a true patient. She's been de-identified or they have been de-identified multiple ways. And we're going to talk about different clinical findings, but this is not clinical judgment. This is not um, just a set diagnosis. This is going to be a case study to use for learning and also for mostly focusing on the systems of the office. I know that as clinicians, you're all well versed and have your own clinical criteria and guidelines as well. A little bit about me. I never wanted to open my own office, and then I did. So I opened Positive Pediatric Dentistry December of 2023. So we are officially 2 years old, which is crazy. And then Little Smiles Co. is kind of a sister office within Positive. The vision and the long-term goal is that one day it has its own space and address and location, but right now it occurs within the four walls of Positive. And this is where we're seeing babies and kiddos that have tethered oral tissues and helping with their release. And really, the co is collaborative, connecting them with care providers before they even come into our office, making sure that we're kind of setting them up for success before, during, and after a release. I went to dental school at VCU in Richmond, Virginia, and then did my pediatric residency at St. Christopher's in Philadelphia. I live and work in Pennsylvania. And like I said, I never wanted to open up my own office. I love learning. I love education. I thought that I would find myself in like academia, and it's just really fulfilling to spend a day with you and now kind of sharing with a group of people things that I've learned that I have found value in my office. So hopefully sharing that knowledge can add value to you. Our objectives today is workflow and everything that has to do with that. So from intake to imaging to team member responsibilities to communication and how we can leverage AI, we can leverage technology and practice management systems like Oryx that can automate so much and integrate so much so that your team and you are doing less of the computer aspects and more of empowering and educating the parents and their families. Why does connection matter? Well, I know I'm preaching to the choir, but connection, communication is just in everything that we do. And we'll see that. So meet Nora Gomez. She is our case study for today, and we'll be talking about different findings throughout kind of our time together. And she is an 8-year-old female, and we'll kind of dive into each of these things. So the patient visit, or as like I like to call it, the patient experience, that's how we refer to it within our team, really starts when the family first hears about you and then they give you a call. So making sure that, things are consistent from that first contact, even as simple as like brand and then moving on to phone call is really important. And then it's unless you're intentionally trying to ask the same questions over and over to make sure the parent is just being thorough. We don't want the families in our office to feel like the only reason that the questions keep getting asked is because there's not consistent communication within team members or within the office or the intake. So during the call, any notes that are taken can be put right into Oryx with some AI features. Mango and Oryx can also put that right in. And it's really nice to be able to have all of that information documented. My team then goes ahead and sends a welcome email, and you can see here on the slide kind of what that looks like. And it just really emphasizes the importance of filling out forms prior to arriving. I know we've all been there, that new patient, you're waiting for them to arrive, they're running 10 minutes late, and they haven't completed their forms. So we really try to eliminate that by sending the welcome email. Oryx lets me select all of the forms that I want to send at one time. It looks beautiful to the parent. It also stresses that we require parent and legal guardian to be there for the first appointment. We let them know, hey, we're going to do an insurance verification check as a complimentary thing that we're doing to make sure that we can empower you of all the information beforehand, to make sure that there's no surprises at the dentist, but we need your insurance information to do that. Also, something fun that's in our welcome email, and I'll show you on the coming slides. It's called My Favorite Things. It's an activity sheet that the parent can print out and just really get the child excited about the appointment, especially if it's a child who's really young, has never been to the dentist before, or has dental anxiety. We find that this is a fun activity that the family can do together, and it makes it more approachable. It also provides us with information that's helpful for us. And then at the end, it just says if there's any additional information to please let us know. So the personalized welcome email, yes, at Pawsitive Pediatric Dentistry, we do have dogs. This is Belle. She's named after the cusp of Carabelli because I'm a nerd. And she has a puppy dog sister named Lucy, who is not currently working full-time at the office, but she's in training and she comes mostly on administrative days. And when the family gets that welcome email, this is at the bottom. Oryx lets me customize that. And when they press the click here, it takes them to the PDF of the favorite things document that we talked about. It asks them their favorite foods, their favorite movies, TV shows, songs, and what makes them smile big. So our kind of tagline is Pawsitive Pediatric Dentistry, where little smiles smile big. So we're keeping kind of that consistent. And it's really helpful if, we know that Nora loves Bluey. Well, when the family is checking in, this is something that is given to our clinical team either directly or it's scanned into the chart. And then we can have Bluey ready to go when Nora is seated. And sometimes even kiddos who can't really write yet, they'll draw, or if it's their favorite color is pink, they'll just color in the whole bubble in pink. So it's been great. So something fun. The other thing that's on that welcome email is it allows the family to create a patient portal that is specific for their family. If there's several children in a specific family, it'll show up like these bubbles below. They can even add another family member. Let's say Nora is going to have a new sibling in the next year. Once that baby, is 6 months old or the first tooth has come in, the family can go ahead and add the sibling there. This allows them to complete all their forms. If they need to update any information anytime, it also shows them their next appointments. If they want to schedule new appointments, they can do it from there as well. And then this all is sent over to us. So before we physically meet Nora, we're going to know a lot about her. This is what that patient portal will look like. And there's also some custom forms here. All of the screenshots in this presentation are specific for my realm and how I've designed Oryx, which is something that I love. There's just so much you can customize, and I've definitely taken the time to do that. And if I can be a resource to you, just in case I forget to say this later, please feel free to reach out. I'm happy to help in any way, especially if you're already an Oryx user. It may be something really easy that we can help you with so that you don't have to reinvent the wheel. But we have here an authorization for caretaker form that is, though we recommend or require, I should say, parents or legal guardian to bring the child for the first appointment and for treatment visits. Grandma can bring the child as long as they're on this form. Record release form would be if for some reason they would like to go to another office for a specific procedure that we are not referring them to. It's a record release form there. So something else that I truly love about our intake forms is that the dental history and the medical history are specific for pediatric patients. And not only that, but the pictures and how it's asked, it's very intuitive for the parents and may even help them think about problem areas that they hadn't thought about before. For example, does your child have a history of, and it has all of these pictures. And sometimes parents will come in and say, well, my child is 3 and your intake form asked about nursing beyond the age of 2. Is there a reason for that? And it's just a nice way to make parents already start thinking about conversations that we're going to be having, and they're not put on the spot. And it just helps with that clear communication, streamlining that workflow. So then Nora arrives. Before she does, in the pre-appointment checklist, this is something that is in the schedule view. You can also customize what's on here. This allows the team to make sure that there's a consistent approach with each child that is being checked in. So was the welcome email sent? We have a sheet, an intake sheet that we use, so that they add in all the notes from that sheet, that they put who they were referred by. As you know, if you're going to be investing in making sure you're getting good referrals, investing in marketing sources, you want to make sure you're documenting where they're coming from. Another great thing about the intake form is it also asks them that, and you can have a checklist of different options as well. Importing the history, did we review it? My team, both the business team and the clinical team, does a chart prep where they're ready for the patient. They are checking to see if there's any tags they need to add to that appointment. Is the insurance verified? Balances, credits, and so forth. So this all happens before the patient arrives. During check-in, we have a very similar list that the team member can go through. And then once the child is ready to be seated, we bring the patient back and then get height and weight, et cetera, which we'll kind of go through as well. A new feature, or I should say newer feature in the last 2 years that I've been using Oryx is this huddle button, which is super awesome because going forward, these are some documents that I make for my team for them to be prepared with patient flow. However, this huddle button provides them a lot of that information at their fingertips for either the day. You can toggle here. It lets them know if the patient they're responsible for, do we need to get any consents that haven't been signed, or did the parent already sign it in the portal? Are there any insurances that are yet to be verified? You know, we want these verifications to be done at least 2 days in advance. We really try to be a week ahead. Medical history updates, any outstanding balances, just anything that you're seeing there. And the other thing that's really nice is if it'll highlight if there's any child or any patient who does not have their recare scheduled yet, which is really helpful because then that can make the team member who's responsible for that patient have that as top of mind. These are documents that I use, or I should say my team uses every day, and they stay, again, like I said, 2 days ahead. If after this, you would like a copy of it, happy to send it to you. It's just basically everything that I look for when I look at a patient and everything that needs to be done before they're there and after they're there. This helps that when we meet for huddle, we're all talking the same language. We're all ready to meet Nora. We know what her concerns are. We know if there's a significant medical history, if she's been to another dentist, do we have the x-rays from the other dental office, etc. The business team huddle, this makes sure that we're on the same page. Are there any communication loops that need to be closed? When's the next op appointment, the next new patient appointment? And how are we currently doing with our key performance indicators? And are we meeting our monthly goals? So let's meet Nora. Let's walk her through this systemized approach. There's a million ways to do things. I'm just hoping that by sharing the way that we do this, we're really proud of our intake. You can take, like I said, some golden nuggets, hopefully for even Monday morning. So height and weight collection, this is something that's done for every recare visit or new patient visit at our office. And the nice thing is each assistant who's running their own column, they have an iPad. They're able to take the height picture in front of our ruler. It'll document the height. It also creates a cute little photo icon for the patient. So that way in their chart, we have that. Typically, they're not wearing sunglasses. We just have that here to help de-identify. And then weight is also collected. This is helpful because if for some reason this child needs to be sedated at any point, I'm able to calculate BMI at any moment, and kind of have those conversations with patients and the parents more specifically. Intraoral photos are taken as well, of the full dentition for every patient that allows in terms of behavior. And if there's an area of concern or something that the team is seeing that they're not sure about, of course, that area, a photo will be taken. We find that even with our young patients, this is something they get really excited to see themselves and to see their teeth. So we even get intraoral photos on 1-year-olds and 2-year-olds, and we find this to be really helpful for the patient, but especially for the parent. If we're talking about areas we need to brush better, floss better, once parents see that, it's way easier to now implement an action. They are not really seeing it, and you'll see this as a consistent theme when we start talking about x-rays as well. It's hard for them to understand the importance. During our huddle, typically because our intake forms are completed, at huddle, I'm able to prescribe if there's specific x-rays I know I'm going to want. So with Nora's intake form, the parent wasn't sure when her last x-rays were. She wasn't flossing, and we knew that she was 8. So as long as she had closed contacts, we knew that we were going to be doing 2 bite wings. And sometimes, you have to get a little bit more to be able to cover the teeth, but technically 2 bite wings and then a pan since it was her first time with us. And then from there, after having all of that documentation, I go through and present everything to the parent. So let's, like I said, dive into Nora. So Nora is an 8-year-old female. On the intake form, parents disclose that she has mouth breathing at night, snoring, and is struggling currently with some nighttime incontinence. Mixed dentition with lower crowding. On the intraoral photos and exam, we saw deep grooves, and in the radiographs, we saw some early interproximal changes, some incipient lesions, and parents disclosed some mild anxiety, and they weren't sure when she had x-rays. They said maybe over a year ago. So we knew she was overdue for radiographs. So this is that view. If you're a current Oryx user, in your iPad, when you click on the smiling kind of picture and you take a picture, it'll go ahead and populate right away for the patient's icon. There's way more views than we need as pediatric dentists. However, I'm really annoyingly thorough at times. And when an orthodontist refers or sends us a treatment plan and they send us, the cute little pictures that our patient took, we go ahead and we put them in here. So if for some reason the parent has a question, recently I had a situation where there was a child who started getting ulcers, and the parent wasn't sure if the child had any ulcers when they were at the orthodontist, and I was able to go through and look because we did that. So that was something nice. So medical history, this is kind of how we go through here. If I have any notes or comments, the team is typing that when I come introduce myself and kind of just re-review the medical history and talk to them. The parents sign. Any changes are populated as this little bubble here, so that's very nice. And then just really going by the American Academy of Pediatric Dentistry guidelines on x-ray selection there. Intraoral photos, again, because this patient was kind of deconstructed and reconstructed, they're under uploaded. But when you're taking them at the office, they would go under acquired. But uploaded is also really nice. If another office is referring something specific, they can send you a picture and this is where it would live. Or if the patient had a fall, a trauma, and there's a tooth that's broken, chipped, bleeding, the parent can send a picture via text. It shows up right here in this little chat box, and the team can move it over to their chart. So going through, we know here we're seeing the close contacts, and we're seeing a very prominent lingual frenum, which we will come back to and see how easy it is to kind of document this in Oryx. Clinical exam, when we're going through that, there's lots of different tabs, and I really love to have the ability to document as much as I would love. And my team kind of dances through these tabs as I call out existings, treatment plans, as we all do. I just had never worked with a program that allowed me to put so much details in, something as simple but not, as partially erupted teeth, as hypoplastic teeth. I've always wanted to be able to do that. Another part that's really nice that I like is when we're going through, if there's any head and neck findings, any intraoral swelling, any cheek chewing, any fibromas, there's a space to put that. And I had never been able to do that before. So I'm really happy about that. This is the view where I would say the majority of my clinical team lives. So if you're a clinical team member listening or a doctor to one, and they're saying, where should I start? Like when you're talking about existing and then you're talking about treatment, like where should I be to make it the most efficient? I find that this is the view that's most efficient for my team to mostly live in. If I need to see an X-ray, I am able to go over to the camera icon and see the x-ray at the same time or in the same view as my team is going through different findings or putting in treatment. So on the left-hand side, you have or I should say, if you're facing the screen, on the left-hand side, you have things to treatment plan, and then on the patient left. And then on the patient right side, you have the existing findings. Sorry about that. I was thinking about patient left and patient right. So here you can also see the radiographs as bite wings and the pan here. In the previous view, this is if you were in a different tab, you can always access this view. You can always access your bite wings or your intraoral photos, but you can also specifically go to that view, just user preference. So these are Nora's bite wings, and usually with our workflow, I'll sit down, show the parents the x-rays, talk about how the teeth have closed contacts and how this is like the teeth being best friends. And this means that the toothbrush bristle isn't able to reach in there. We all have our spiel, right? This is also a great view to talk about how they're saying she's snoring at night and that some wear is noted. We can see here the canine. We have that wear defect right there on the incisal edge. And then turning on our Pearl AI, which is automatically integrated right into Oryx, I'm able to just press this little button and it allows the lesions to turn hot pink. And quickly the parents say, oh, what is that? What are we going to do about that? And it just really helps streamline the conversation because I'm like, great, I love that we're seeing the same thing. One, I can talk about the canine here and say that, that is that wear defect that the computer is picking up. But then there's also these other lesions, these little pink spots, and those pink spots are showing us that these are areas of concern. These are cavities that are starting, and we have the conversation that this white outer layer is the enamel, as we know, and then this minty layer is the dentin. And when we are still living in that white outer layer, we're able to remineralize, or as I tell the kids, freeze tag the cavities that are starting so that in hopes of stopping them and they don't get to the minty layer, where then we would recommend a filling. Now, I tell them what we do is helpful, what they do at home is most helpful, and we talk about flossing and all of that, but you all know that. The really awesome thing with this visual, we're able to educate the parent. They're able to see, oh, I thought that flossing really wasn't that important. They're able to see that it really is. We're able to educate the patient. The kids get really excited. It's very user friendly for them because it's nice, beautiful colors. And something really cool that Pearl does is there's almost like two pathways. So when Pearl detects that the child is under 12 or in mixed dentition, it goes to a simplified view. This is the simplified view of really just focusing on the cavities enamel, dentin, and allowing us to really just have this streamlined basic conversation with the parent. On the adult view, there's a lot more kind of labeled and shown, which we don't really need as much in the pediatric view. And this is something that Pearl just does automatically. So you don't have to really focus about that at all. And here's another view there. And then typically after we talk about the x-rays, we've done the treatment plan. Something that I always will do is an airway assessment. And in this case, it's Nora's chief complaint or her parents' chief complaint. So we're definitely going to address that. We're going to get, our Mallampati Brodsky. And I love that we can also put in our tongue elevation and how she's probably somewhere between 50% elevation and talk about what that means and how we can then address those concerns. And it'll go ahead and add all of your findings and then give you a grading scale at the bottom. So now you have something to show the parent. It's not just these findings in isolation, but you can then start to have the conversation of, between minimal concern of her airway and severe concern of her airway, we're sitting at about moderate. So let's talk about things that we can do to help lessen that scoring table and how we can help her just really thrive overall. And this is very similar to FAIR 6, which we know and love. The screening tool has been super helpful, and it's nice that we have something very similar built into Oryx that then you can print out, you can attach to a referral if you're going to have a referral to ENT and or ortho and or an oral myofunctional therapist. You can select all of these findings that you're already documenting right in your referral tab, and it's just allows the whole care team to be having the same conversation. In terms of treatment planning and consent, something else that we do is with the Oryx like automate features, we have automated each consent with our codes and also our post-op instructions and really what to expect anytime that nitrous oxide is recommended. So this allows the parent to have all the information before the child even comes in. That way, the first time they're seeing consent forms, the first time they're seeing post-op forms is not before, during, or after the procedure. It's really before they even arrive. We find that any questions or, those families who they mean well, but they just have a lot of questions, or maybe that difficult family that sometimes is asking the why, is this really needed? Do we really have to do this? What materials are being used? You can have all of those conversations before the child even arrives for treatment. It just allows us to have very consistent language. And then you can go ahead and send the treatment plan, and this goes straight into their portal as well, which is super helpful. So we've documented all of these things. Now you're going to go do your note. You can create your own template note, which is really awesome. But the other thing that I think is even more awesome is that you can go and click generate exam note, and all of the notes that you've taken throughout the appointment. And there's also like a sticky note tab that I wanted to highlight, can go back and show you at the end. Allows you then to everything you've documented, everything your team has put in will show up in your note. So you don't need to worry about retyping the areas of decay or how restricted the child was or where was noted. It'll generate it all for you. And then in referral forms, you can create templates for all the different types of referrals you like to write. And then you can select portions of your medical history, dental history. You can select pictures, everything I was saying with making sure the care team is on the same page. So systems in action, this is just a small part of my team. They couldn't all fit in this little clip here, but they're amazing. Pictured and non-pictured members. They are kind of the heart or right of everything that we do. So we want to make sure that we're empowering them to be efficient and that they have buy-in, because when someone feels confused, if someone doesn't know what to do or feels like they're just having to do the same thing over and over again, we're humans, we're less likely to do that. If we feel like we're able to do things systematically and efficiently, we're more likely to complete tasks. And then also these visual tools are allowing us to have parent confidence. there's been many a times when I've been a second, third, fourth opinion. And just because I've said the same exact thing as the previous dentist, I've even probably given the same exact treatment plan. But just because the parent was able to see the x-rays in a new way or was able to see the intraoral photos, now they felt like they were a part of the conversation. And now they're like, okay. And yes, maybe part of it is now they've heard it so many times that they definitely have more trust, but I do think that the visuals definitely help. So hopefully you can put some of these steps into action, standardize your appointments. If you take nothing else, maybe this can help you reflect on, okay, what are the steps that happen before a patient arrives, when a patient is here, and when they leave? I know that I'm not perfect. It's something that I'm always looking to tweak as well. Going into the startup journey has just made this whole area be something that I'm really passionate about. So hey, if I can be a resource to you, awesome. And if you have any constructive feedback, also awesome and willing to take it. Hopefully, after this talk, you can also adopt some consistent imaging, whether you're already an Oryx user, you already have Pearl, or you have both, and you're trying to really leverage that quality and that amazing investment that you've already made in your office and really systemize your exam flow. Awesome. If not, and the team will later talk about ways that you can demo that and see if that's something that you can add to your office, because I definitely see the value and hopefully now you do too. And then hopefully you can implement a more structured treatment planning approach, whether that's automating codes or pathways or your consents or your post-ops. So hopefully at the end of the day, the people who are truly benefiting from us to take the time to do all of this is the people who matter most, our patients. And really, thank you so much for your time. Like I said, there's not a lot of Dr. Milkas in the world, so I'm sure you could find me on Instagram. Feel free to send me a message if I can ever be of a resource to you. Before we officially end, just some exciting things coming soon. So we talked about Nora's x-rays and how that looks, but soon in Oryx and Pearl will be providing this, you'll also be able to show these cute little sugar bugs. So we all have the child who really doesn't want to see their x-rays, totally fine. But the child who does, especially because the colors are so inviting and so fun, this allows them to be able to see and kind of understand. And I find that showing incipient lesions almost just as important, if not more important, than showing areas that we need to restore, because these are areas that we can actively keep arrested. And these are areas that are really kind of their fate is up to the parent and the child. Um, I know there's some general dentists in the room. We didn't totally forget about you. Um, these are adult teeth, and there's a lot more that is labeled. You can see down here: bone, dent and cementum, restorations, measurements for you. I believe also like calculus can sometimes be detected. So there's a lot more in that realm too. It's not my forte, but there's definitely people here who can talk about that too. So thank you so much for being here. I hope I didn't take too much of your time, but I'd love to answer any questions and see how we can help.
Incredible performance. First of all, I want to come work for you. So fun.
Thanks.
Amazing. I mean, these patients are so well taken care of, though
Oh,
your
thank you.
way you walk through this is really, really a testament to how well you treat your patients. And what an honor to have you share your workflow with us. And I learned a ton. So there are some questions we want to get to, some technical questions, but I wanted to ask you first, if you were starting fresh, completely all over, what would be the one thing that you would implement right away that was the biggest like game changer for you?
So, something I haven't done that I didn't do that I wish I would have would be to require a card to be on file.
Mm,
That would be, I think, because everything else, all of my wish list items, I've been very fortunate to have. I knew I wanted to have Oryx from the get-go. I knew that I wanted to try to be an early adapter as much as possible of a lot of different like technologies and things that I could leverage. So I feel like I have a lot of that. but I think it's just hard to retrain humans. That's the hardest part of, right, of being a practice owner. So if I could have required that from the beginning, especially because with a card on file, like Oryx will send out an automatic statement. And in our policy with a card on file, we're able to then charge right away after sending the statement. And the other aspect of that is that having those automated notifications, just the parents are already in the know.
I love that. My takeaway was I need to get a dog in my dental office.
It is pretty great.
But yes, we're going to have some questions right now, some time to dive into some things about huddles, same day dentistry. I am going to share the CE code as soon as I finish with Q&A here. We want to open this up so that you guys can actually just take time to speak with Dr. Milca directly. But there are two QR codes. Again, we're an incredibly tight partnership here with Pearl and Oryx. And we encourage you to schedule some time. You know, Oryx has so much going on. It looks like they've solved a lot of the pain points, right, that we have to deal with on a daily basis inside of their system. And they will also give you a demo of Pearl. So you can see the whole Oryx system. You can see, okay, now show me the x-rays. Now turn on the AI. And I think from a Pearl perspective, what we love most about integrating with partners is there's no change in workflow. So, you know, you take x-rays, you don't upload anything, you don't use different sensors. In real time, you snap that first bite wing and you have those little yellow incipients or those pink, you know, progressed areas of concern showing up for you to review as a clinician faster and then to turn around and face that to a patient in the sugar bugs format or to a parent showing, you know, that these are the ones we actually can keep an eye on. These are the ones we're going to fill. So again, just want to kind of encourage you, if you think this is a great fit, we'd love to talk to you and bring your team and see if this is a good match for you. I do want to start with clarifying. There's a question from Rosalie, as well as a question about the huddle button. And I would like to talk about how your same-day dentistry workflow is, and if you're seeing an increase in case acceptance with showing these visual aids, allowing you to have more same-day dentistry, which is a little interesting with kids.
Yeah. So I would start by saying, as a general rule, we don't do a ton of same day dentistry for the first reason being that usually your parent more, but the child, let's say, is nervous. And we want them to meet all the key players and we want them to see the space. We'll show what a nitrous nose looks like before we do any treatment. Now, we do same day dentistry frequently when it comes to things like silver diamine fluoride or sealants. So we find that our workflow really helps us have that. And at Huddle, we'll talk about windows of opportunity. And that's a great place to talk about that. So we know that Nora is 8. If she had never had sealants before, window of opportunity is how we would structure that in our conversation, is that she would be a great candidate to get potentially sealants. And we can already check with that verification process if sealants are covered. So that way, when we're taking the intraoral photos, we're showing the x-rays. When we talk about treatment planning, if the parent's like, oh, well, can we do any of this today? It's like, well, we will schedule the treatment. However, we are able to do the sealants and the first application of our silver diamine fluoride to stop those sugar bugs from spreading and just freeze tag them. Today, and it looks like your insurance is actually covering it at 100%. So it really just empowers the team to go ahead and take action, start getting consent, start being set up. And so from the huddle button to same day dentistry, that's kind of how that would play out. I hope I answered that question well.
Yes, that worked for me. Kimberly, I know you're watching the chat here. Um, if you want to chime in and let us know if you see some additional questions, and I wanted to talk about a takeaway at the very end.
Yes, perfect. There's a question about implementation, and it didn't specify whether that was as you were starting with Oryx and or Pearl. So maybe you could speak to both since you have started with both. If you could
Yeah.
just speak to like getting your team on board, implementing these new systems, some best practices, and was it a huge heavy lift?
Yeah. So I can only speak on implementing as a startup. So I know that implementing as an existing office, maybe switching to a different system, sometimes you might have to take more time in the beginning. As a startup, this is all my team knows. I do find that team members who have a long-standing history in dentistry sometimes takes them a little bit to learn because it's kind of like restructuring maybe what they're used to. They may already have this is how I go through an appointment. They may already have their spiel. So it just takes a little bit more practice. Where team members who don't have any prior dental experience, both Pearl and Oryx are so user friendly that just kind of clicking around, they end up figuring it out before you even try to show them. And then they end up becoming almost like the master. So, my, I guess, tip would be if there's anyone in your office who is drawn to it. It's just very excited by new technology, excited by having the right answer, excited by being able to help, kind of empowering them to learn different things, whether they're watching training videos, whether they're reaching out to support, or in Oryx, there's usually like a little megaphone that tells us like any new things that are coming up. And I have two team members specifically that always click it and they're always figuring it out. And then when we have huddle, we always have positive starts, learning moments. It's always a great point to talk about what that person learned. So now they're not the only person who knows it. We can all know it and all put it into action.
Excellent.
Perfect. Thank you. And then Sheila, I think you asked this, but I'm sorry, I was reading the chat when I think you asked. But did you ask Dr. Milka which intraoral camera she's using for intraoral photos? Not what intraoral camera, rather, just for your intraoral photos, what camera you're using?
Yes. I think it's called Pro 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 Mouth. There's mouthwash and then there's like another one. I think it's called ProDent. Whoever it is, if you find me on Instagram and direct message me, I can send you the Amazon link.
Love that.
It's like a $200 intraoral camera. It's really nothing crazy. I feel like it's already paid for itself several times over.
Okay, perfect. That was it for my question, Sheila. I'm back to you.
Excellent. Yeah, I think you covered it. I think that a lot of times that what we hear about is this barrier to implementation, whether you're moving to a different software or whether you're moving to an AI system. And I think it's important to know that when you're looking at an imaging system and being able to evaluate all of the additional features, and again, what Oryx has done is solved so many pain points and automated those so you have more time to spend with your patients, right? And that's what we love about working with partners that really focus on that patient journey. So Dr. Milka did such a wonderful job today walking us through that. And again, if you notice that you have great case acceptance, which is what we all want, which is why we went into dentistry, right? Was to just help patients have great experiences, especially in the pediatric sense. Like you guys are responsible for establishing how they're going to feel about dentistry for their entire lives.
No pressure.
Right? Exactly. Exactly. I know. I know. And I'm thankful to all of the specialists out there that are spending so much time making those appointments so valuable. But when it comes to that moment where you do have to educate a parent, I remember as a hygienist, and I'm flossing my kids' teeth since they're born, and my kid got a cavity, I felt horrible. But I took him to a pediatric dentist, which was funny because I wanted him to have a good experience. And he's like, that's who's going to be in there for 5 more years. You've got to put a cavity. I mean, you've got to put a filling in there. And obviously, I know what x-rays look like. But my friends come to me and they're like, why do I need to fill my kid's tooth? So that's where I felt like Pearl in pediatrics has been the biggest win to be able to explain those areas. And parents don't know that decay progresses so much faster in little children's teeth, right? And the enamel's smaller. So I do feel like this is the cherry on top of any wonderful patient experience. So thank you so much for sharing your experience with us. I love your empathetic and compassionate approach. And again, thanks to the Pearl team. Well, yes, the Pearl team and the Oryx team for just your partnership. And we'd love for you to reach out to Dr. Milka. She has so many great ideas that could help your team. We'd love to see all of you on a demo so that we can see if we're a good match for you. Please feel free to visit hellopearl.com for additional webinars in the future. We love to be your CE source, and we're always here for you at any time. So have a wonderful day and a wonderful holiday season, and we will see you back in the new year. Bye, everyone.
Bye-bye.